Hello everyone. In this video, I will be sharing another US FDA new drug approval update. On March 26, 2026, the US FDA approved a long-acting once-weekly insulin analog, AWIQLI, insulin Icodec. AWIQLI is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus. This approval represents the first once-weekly basal insulin analog in the US. Now, let's dive into this medication in more detail. Insulin Icodec, brand name AWIQLI. This medication was approved by the US FDA on March 26, 2026, and indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus. Chemically, AWIQLI is a chemically modified human insulin analog. Compared to naturally occurring insulin, several structural changes have been made. First, tyrosine from the A chain 14 position has been replaced with glutamic acid, and tyrosine from the B chain 16 position and phenylalanine from the B chain 25 position have been replaced with histidine. Second, the threonine from the B chain 30 position has been removed. Third, a lipophilic side chain has been introduced and anchored to lysine at the B chain 29 position to make the insulin drug molecule more lipophilic, enabling high protein binding and prolonged half-life. Insulin Icodec has a molecular weight of 6,380.26 Dalton. This medication is available as 700 units per ml, U700, as a clear and colorless solution for subcutaneous injection. The dosage strength include 3 ml single patient use flex touch prefilled pen containing 2,100 units, 1.5 ml single patient use flex touch prefilled pen containing 1,050 units, and 1 ml single patient use flex touch prefilled pen containing 700 units. AWIQLI is administered once weekly as subcutaneous injection, and the dose needs to be individualized based on blood glucose monitoring results and glycemic control goals, along with metabolic needs. For recommended starting and maintenance doses in insulin-naive patients, or for patients switching from daily basal insulin to once-weekly AWIQLI, see prescribing information for details. Given this is a peptide product, for unopened product, AWIQLI needs to be stored in a refrigerator at 36 to 46 Fahrenheit, which is 2 to 8 Celsius. Do not freeze. For opened and unopened AWIQLI product, it can be stored at room temperature for up to 12 weeks. Mechanistically, this medication works to lower blood glucose level by stimulating glucose uptake in peripheral tissues and inhibiting glucose production in the liver, inhibit lipolysis and proteinolysis, promotes protein synthesis. AWIQLI binds reversibly to albumin, resulting in a depot in the circulation and slowly releasing insulin Icodec. Pharmacokinetically, Tmax, that's the time to reach the maximum plasma concentration, 15 hours. Protein binding over 99%. Metabolism, similar to insulin. Insulin Icodec is expected to be metabolized by proteolytic cleavage of the peptide backbone, leading to inactive metabolites. Half-life is approximately 1 week. Given its long half-life, therefore this medication is administered once weekly. Drug-drug interactions. Drugs that may increase the risk of hypoglycemia. For example, antidiabetic agents, ACE inhibitors, angiotensin II receptor blockers, ARB, fibrates, fluoxetine, monoamine oxidase inhibitors, MAOIs, sulfonamide antibiotics, GLP-1 receptor agonists, DPP-4 inhibitors, and SGLT2 inhibitors. Drugs that may decrease the blood glucose lowering effect, atypical antipsychotics, corticosteroids, diuretics, estrogens, glucagon, niacin, oral contraceptives, progestins, for example in oral contraceptives, protease inhibitors, somatotropin, sympathomimetic agents, for example albuterol, epinephrine, and terbutaline, and thyroid hormones. Drugs that may increase or decrease the blood glucose lowering effect, alcohol, beta blockers, clonidine, lithium salts, and pentamidine. Drugs that may blunt the signs and symptoms of hypoglycemia, such as beta blockers and clonidine. Contraindications. During episodes of hypoglycemia and hypersensitivity to insulin Icodec or any of the excipients in AWIQLI, see full prescribing information for details. The common adverse reactions associated with AWIQLI include hypoglycemia, hypersensitivity reactions, for example, urticaria, swelling face and lips, injection site reactions, lipodystrophy, pruritus, rash, edema, and weight gain. Here are the key references which I have used to prepare for today's video. The US FDA New Drug Approval Updates for 2026 is a very valuable resource. In addition, most of the medication information which I shared today is based on AWIQLI prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer website. Finally, I want to thank you all so much for watching. If you found this video helpful, consider subscribing for future medication video updates. As always, keep learning and elevating. Thank you so much.